surprisingly, my clinical placement turned out to be school nursing. I'm adult and paediatric trained, and I was assuming that I would end up on the wards, perhaps looking after adult patients. And when I said that that wasn't particularly my first choice, they were very accommodating, and the senior tutor suggested paediatrics and school nursing, which was quite inspired and turned out to be remarkably successful.
A normal day on placement is very much like actually working a normal day on the ward. You arrive at the normal time, 7:30, you have the handover with the rest of the staff, and you are allocated a certain number of patients, which your mentor will also oversee. Then you actually are responsible for caring for those patients. Your mentor will oversee things like drug rounds and things, but basically you are looking after these patients. And at the end of the day, you are actually assessed by your mentor, and he will tell you how you did or didn't do and how to improve.
The joy of the clinical placement was that there was no typical day. In my own case with school nursing, each day was different, in which case it was either mental health or it was physical health. And I think that was really quite challenging, but also it meant that you never quite knew what was going to happen when you went through the school doors. And that was really quite exciting. So again, there wasn't a typical day, but that's the nature of school nursing. And that turned out to be challenging, as I say, but with plenty of support, I got into my stride, and it was really remarkably enjoyable.